What's the first injection that a 60-year-old with knee arthritis should consider if they're having pain? Hello, this is Dr. Siddharth Dambar, physician and expert in rheumatology and regenerative medicine, physician here at Chicago Arthritis and Regenerative Medicine. Frequent question that I get asked, and one that I was asked recently on one of our social sites, was it's an individual who's in his 60s, having more and progressive knee pain from osteoarthritis, and wanted to know what sort of injection that he should pursue next. His orthopedic surgeon had initially recommended a steroid injection to him. He was a little bit cautious about that because he'd heard bad things about that, and so was then recommended some other options, and he wasn't exactly sure how to proceed. So here's what I would generically suggest. First and foremost, before injections for knee osteoarthritis, please make sure you are optimizing everything you can from your end. That includes lifestyle changes, such as leg strengthening, core strengthening exercises. That can be through physical therapy or on your own. Next is using the right over-the-counter joint supplements that can help with pain and inflammation, such as glucosamine, omega-3, and curcumin. All very low-risk options and preferable over pain medications and anti-inflammatory medications that can have other side effects if you're using them daily and chronically for too long. Next is need to also focus on weight optimization and weight loss for a couple of reasons. Number one, every pound of excess weight that you have will lead to 4 more pounds of weight on your knees. So if you are, let's say, 15, 20 pounds over your sort of ideal or appropriate weight, losing that can help to reduce the stress and the pain on your knees. Also keep in mind that metabolically, if you're metabolically not at an ideal state, that means maybe you are a bit overweight or maybe your blood sugar is not fully optimized, you can also have a bit more inflammation related to that as well. Optimize your metabolic health. You can also reduce some of the inflammation in your joints as well. And then if you need to do any other kind of activity modification, for example, let's say you are someone who works out super heavy, doing a ton of heavy weightlifting. Maybe the knees are not quite able to fully handle that. Maybe you need to moderate that a bit, try to improve some of the strength, try to improve some of these other factors like your weight. And if that is enough, then you can escalate your activity again to then see if you can handle more of the load. If you've done some of these options, conservative lifestyle options, and you're still having pain, then considering an injection option is appropriate. So frequently and typically, at least in this country, the first line injection option that you'll be offered is a steroid injection. And the reason for that is because it's easily available and super cheap. The problem is that while it can give pain relief short-term can mean from days to a few months, and essentially steroids work by reducing inflammation in an area that's being treated. The problem is that if you get too many of these, it can be harmful in the following ways. Number one, it can actually degrade tissue that's being treated, whether that is soft tissue or cartilage. It's not great for that. In addition, too many steroid injections do have an effect on you metabolically. That can include on your blood sugar, your blood pressure, your weight. You can gain weight from that. Your adrenal glands, if they're exposed to too much steroids, will get suppressed as well. The adrenals will get suppressed. And it can even cause damage in the bone. So you need to be cautious about using too many steroid injections. And I wouldn't even recommend that as a first-line option because it's short-term and it doesn't really treat the cause of your pain. The cause of pain in someone with knee osteoarthritis is a combination of chronic instability from prior injuries and strains and weakness of the soft tissue structures, like a ligament and a meniscus, now leading to more instability and then pressure on the joint. And also, because of that, some degree of chronic inflammation that can occur as well. So the next type of injection that people will frequently be offered are hyaluronic acid injections or gel injections. These are essentially low risk. They can help. They last longer than steroid injections, perhaps up to 6 months. They help by causing some progressive longer-term reduction in inflammation in the joint. Again, not really fixing the problem of instability, but they are helpful and a low-risk option. I think that's okay if you've been recommended that as a first line. My preference, however, is treat the cause of your problem, which is instability. And the treatments that work for that are your orthobiologic treatments. There are three options. If you've got a mild issue, and that means mild arthritis or mild instability, then prolotherapy, using dextrose to strengthen the ligaments, treat some of the joint inflammation, is a good first-line option. It can take several treatments on a monthly basis to make a difference, but it's a good first-line option. If you have more moderate level arthritis or instability, platelet-rich plasma, where you're using your own blood platelets and the growth factors, is a good appropriate first-line option. On the other hand, if you have a bit more advanced arthritis or more instability, then using your own bone marrow stem cells is a good option. So a lot of it depends on your severity of your problem, your overall health, what other treatments that you've failed. But my recommendation is if you've failed conservative options, you're still having pain, the next line injection option that you should consider is an orthobiologic option, prolotherapy, PRP, or your own bone marrow cells as a next step to treat your issue. I think that will help in terms of improving your stability, reducing inflammation, reducing pain, improving your function, and overall improving your quality of life. If you're interested in learning more, check us out at chicagoarthritis.com or check us out on any of our social sites. Thanks for your time. Talk again soon. Bye-bye.